Our guest is Dr. Yumna Musatat. She is the lead pediatric hospitalist at the new Thomas Memorial Hospital Pediatric Unit. Welcome, Dr. Musatat.
Thank you, Dr. Rashid, for the opportunity to join you today.
Our topic is the new WVU Thomas Memorial Hospital Pediatric Unit. Doctor, there is a children's hospital in Charleston, but why did WVU and Thomas feel that a new children's unit would be necessary or helpful?
So we all know, being just like working in the health field for many years, ERs get overcrowded with pediatric patients like during winter time, during respiratory season. So there is a need for additional resources. Our pediatric inpatient unit has 8 private beds or rooms that accommodate patients and families to receive health care when they need it. So our unit actually is an extension of WVU Children's Medicine, which is the home for the most experienced and largest group of subspecialty.
So you are still a pediatric specialist at West Virginia University Medical School?
Correct.
Yeah, okay.
I'm a pediatric hospitalist.
Go ahead.
I'm a pediatric hospitalist, so my goal definitely to provide patient care for hospitalized patients during acute illness.
Okay. This is a new term that many people don't understand now. When you're in a hospital, they let you see a hospitalist. Would you explain to us the difference between the doctor and a hospitalist and tell us more about this, particularly in pediatrics?
Yes, so the hospitalists, they do have a unique training to be able to take care of acute condition or illnesses around the clock. So the patient, they're sick enough to be admitted to the hospital. They need that continuous medical care around the clock. So in addition, we work very closely with the primary care physicians when we take care of these patients who are admitted. We try to make sure that we reach the appropriate diagnosis, and provide the appropriate treatment. So in addition to taking care of the patients, we try our best to take care of the families. Again, being in the hospital is the scariest probably moment for the parents. To have a sick child is very scary, but we try our best to address their concerns. If they need any help, additional help to connect to resources, we definitely try our best to provide that to you.
So you are trying to open up the door to southern West Virginia and the greater Charleston area for care of the highest caliber from locally and from the West Virginia University.
That's correct. So again, my new role since I joined WVU Medicine family, I am the medical director of inpatient services in the southern area. And this is kind of in addition to taking care of the family, taking care of sick patients. So the new role of building a new unit up from the ground, I would say this is very exciting opportunity. It's challenging too. And I could have not done it without the support from Dr. Rosenkrantz.
Yes.
He is the president and CEO of Thomas Hospitals. And with the help and support from the leaders at WVU Children's. Amy Bush, she is the chief administrative officer. In a period of time, this short period of time, I've learned from her a lot. Her commitment, inspiring.
So they have decided that we need a new pediatric unit in our area. Would you describe the unit to us? How big is it? What do you do there?
So it's a unit of 8 beds with, I mentioned earlier, with accommodation to for families to be able to stay with the children during their hospitalization. We do have an access to subspecialty services, from Morgantown.
So not only can you utilize our local talents,
Exactly, and this is the biggest, I would say, new opportunity for the patients locally to have that easy access to services in Morgantown at WVU Children's.
including helicopter, air transportation.
If needed, definitely.
If needed.
If needed.
Is that very often that you have to helicopter patients in or out of Thomas unit?
Yes, it's definitely if we have a sickest patients that they need to be transported, that's definitely an advantage.
We have a lot of accidents in our areas, like car accidents and fires and all. So are those patients admitted directly, or are some of them, do they have to be sent to Morgantown?
So for trauma, we are not keeping trauma service or patients yet. Again, if we have a pediatric trauma, they will go to the nearest trauma center.
Okay, so you felt that there was a need for a new unit. Have you had any patients?
Yes, we have had several patients since that we had the ribbon cutting 3 weeks ago. And then it's been just a pleasure to provide the services. We've been working with parents. We received several positive feedbacks, which we really truly appreciate from the parents. So again, we always try to encourage the parents to raise up if they have any concerns, because that will help us to improve.
Okay, these are patients. Thomas Hospital is a hospital. So why can't you just admit a child as a general patient to a hospital? Do they need special care?
They do need special care. If they're admitted, they need special care. They need sometimes IV fluids. They need certain IV medications as well. Sometimes they need to get a consult from specialists. So, and special studies done, EEGs, echoes. So we've been able to provide all that during their hospital stay.
So also, in your unit, what happens when you have parents there that with kids? Kids don't like to be separated from their parents.
Yes, definitely parents will be able to stay and support the child. We allow 2 visitors during the daytime, but again, we definitely have the ability, we accommodate the parents to stay overnight.
Do you teach the parents there what to do when they take them home, or how to? Some of your patients have chronic diseases. What do you do, and how do you tell the patients about this?
Yes, this is a very important part of what we do on a daily basis. So parents, teaching, and education. So before they leave the hospital, we make sure to educate the parents about what to expect when they go home. When do they need to bring their kids back to the hospital? We definitely, for chronic patients, before they leave the doors, we want to make sure that we connect them with all resources that they will need. We want to make sure to connect them with all specialists. We arrange all these follow-up appointments with the specialists before they leave. Because, our biggest fear is just if they leave the hospital and they lose that follow-up.
And maybe readmitted.
And readmitted, yeah.
Again and again.
Exactly.
That's very important, because you're going to be serving a very diffuse group of kids. What type of illnesses do you see and admit to the hospital?
So the most common conditions that we admit for is going to be respiratory illnesses like pneumonia, bronchiolitis, asthma exacerbation, abdominal pain in general, any neurological problems like seizure disorder, headache, severe headache, syncope. So these are the most common type of diabetes as well. If they have a new onset diabetes, they have to come in, get admitted, get the education and the treatment needed.
Now, do you admit chronically ill patients or only acute ill patients?
Definitely, chronic patients, they will get admitted, especially if they have like any acute exacerbation of their own condition.
So those are the ones that are important, that the family understand what's going on and know how to cope with it at home.
Correct.
Do you see any mental children?
Yes, and unfortunately, especially I would say since probably COVID, we have seen significant increase in mental health issues and conditions. So we do see and treat some of these patients.
Well, and that's because the public is becoming more aware of these things and now know that they need to be followed up on.
Correct.
Did COVID accentuate this?
Yes, and again, there are so many studies that prove that unfortunately mental health has been affected, with since COVID has increased, I would say.
Well, my son is, one of my sons is a psychiatrist, and he's in Florida, but he said they're learning more and more about children's mental issues.
Mm-hmm.
In fact, he has just published his first comic book, and he is putting mental things in it to try and stimulate the kids to learn about themselves.
Yeah,
So, yeah, it's interesting.
it's very interesting. It's very-
Now, so we have maybe kids are special. You are special. Now, tell me about your education. Are you not just a doctor?
So, I did my residency in general peds, and then practiced outpatient for a couple of years before I decided to go to inpatient route. So, and I became a pediatric hospitalist in 2011. This is when I started. So it's a little over 14 years. Hospital medicine has become a specialty in pediatrics. So I was had the opportunity to take the hospital medicine board exam. So
You have to be certified to do this?
Yes, it's a new in certain areas you can work as a hospitalist, as a general peds, but I had the opportunity to take the board exam and pass it and be specialized.
So you're board certified in 2 classes?
Correct. General pediatrics and hospital medicine.
Which is the most exciting? Do you practice in private practice or in other hospitals? Now you're in a special hospital unit.
Yeah. I think the most exciting, part about hospital medicine, as I mentioned, is that being able to help the kids to feel better. So I think the most rewarding thing in my career, just seeing them leaving the hospital happier, healthier.
You sound like a mother.
Yes, I'm a mom of 4 kids. And I think this is something when I during my practice, I really try always to put myself in the parents' shoes. So, and that's why I treat every child just like my own.
Well, I always treated my patients like family, and they knew I loved them. So it does make a difference. It does make a difference. Although things have changed tremendously since I was in practice. So I'm learning now it's changed a great deal in the hospital.
It has.
One of them, you mentioned asthma. So yeah, we have a lot of that in West Virginia, and allergies. We have diabetes. What are any special cases that you have, or cases that come in and you can't handle and you have to send them to Morgantown? Tell us about some of those.
So, and again, some of these patients, if they are uncontrolled asthma patients, or if they are in severe respiratory distress, so these patients they will need to, especially after discharge, they need to follow up with a specialist. They need to see a pulmonologist, especially, we're talking about asthma, if you asked about asthma. Mm-hmm. So uncontrolled asthma patients, they need to have a follow-up with pulmonologists. So before they leave, we want to make sure to connect them with the appropriate providers and specialists.
Now, in West Virginia, in the past, we have had some heavy smokers, and they smoke in their homes. Does this affect the children?
Yes, and again, that's part of our job, education. So we always during our encounters, try to explain to the parents about the effect of smoke and secondhand smoke on the health of their children.
So you work with other specialists other than just doctors. What type of people do you have who come in and help either the patients or their family? I mean, do you work with the social workers, or
Exactly.
tell us about some
So
of these people?
the other unique thing about being a hospitalist, you cannot do the work on your own. So it's not like a private practice. You can see your patient, manage your patient. As a hospitalist, you cannot survive without the help of the team. So and I'm very grateful for our team. So the team of inpatient providers should include social worker, dietitian, we have lactation, we have great nurses, therapists. So all of these members are crucial to have a successful service.
That's very important. For example, the pharmacists have to be careful with the medicines, and the nurses have to be careful in the strength of the medicines that they're ordering.
Yeah, and I'm really grateful for our pediatric pharmacist at Thomas. We do have a pediatric pharmacist, which is again very helpful for us, as you mentioned, especially with pediatrics. We certain dosages based on weight, so definitely having a pediatric trained pharmacist and pediatric trained nurses, very crucial.
What about surgeons for different things like an appendicitis or some other thing they need a general surgeon?
So again, our team is expanding. So currently we do not have a pediatric surgeon, but we will make sure if we have an acute abdominal condition that we will make the appropriate referral.
Now, you are a specialist. What about the nurses in your section? Are they special nurses, or do they rotate through every few days?
All the nurses on our unit, they're pediatric certified nurses, and several of them, they have pediatric ICU experience, which is great. So if we put there have been pediatric nurses for over 10 years each. So if you put all these experience together, probably it's more it builds up to more than 90 years. So I'm very grateful for the team of nurses that we have.
So that's important because that's something relatively new, and you'd have to have a special unit to go ahead and specially train nurses just for that unit. So they had to train these before we opened up the unit, or we've looked for specialists?
Actually, we were lucky to hire pediatric nurses who've been practicing for many years before they joined us.
So you do work with the parents. Have you had any comments from the parents or the patients about their care?
Yes, we always and this is rewarding too. When you have positive feedbacks, positive comments from the parents, you can now see it everywhere. Sometimes on social media, sometimes on Google review. So we have had several positive comments about our new unit.
So this makes your life a little bit easier.
It makes it happier.
I understand that. I understand that. Have you had any specific problems with the opening of the new unit?
I would say with Grow, there is always just learning and sometimes pain. So we do have some obstacles, but this is the way to learn and how to navigate what we need to do better. So again, just we analyze certain situations, we figure out the needs to what we need to improve. So, but it's been a very exciting journey.
The association with West Virginia University Medical School and the hospital is unique. So you have services at your disposal that can help you tremendously. So can you handle most of the patients you see on site, or do you have to refer many of them out?
So it really depends. Again, some of the conditions, sometimes we can get like a unique conditions or very like more acute conditions. So these are the like cases that we will have to refer out. But for the majority, we can like, keep like most of the common acute cases.
Now, with the parents, some of these kids have chronic problems. So how can you help educate the parents? For example, let's talk about a baby that has diabetes. Do the social workers or the nurses help train the family on what to do, when to do it, what to watch for?
So when we rounds, we practice or we do family-centered rounds. So during our rounds, we will have like our pediatric nurse joining, pediatric pharmacist, and if we have like therapists like following the patients, they will be joining too. So having that interdisciplinary team is the best way to take care of chronic conditions. So everyone will be on the same page when we go to see the patient, talk to the families. So everyone will be like, we'll go as a team,
Yeah.
introduce ourselves as a team, and then address the issues. And like each one of us will explain like, their own roles and how they're gonna help them during this hospital admission. And we'll figure out like, the follow-up plans right after.
So when you're going around, you don't go just by yourself.
No, we go as a team.
So if you have a special problem, you get the pharmacists and the team together and they all go and work this out.
Exactly, and it helps. It helps to finalize the plan, so the nurses will be aware about like, okay, what's gonna happen today? What are the tests that we're ordering today? The pediatric pharmacist will be able us to, again, if there is any need to modify or adjust like medications, she will help too.
So is there anything that the public in general can do to help the kids?
Of course, I think we cannot do what we do without the support of the community. So like the support, the love from the community is very important for us. And I always think about it as it takes a village to raise a healthy generation, to put a smile on the face of children. So the community been very generous as far as giving donation to the unit. So, and we will always appreciate any donations that they will provide. That will include like toys, stuffed animals, coloring book. Little things make a huge difference in these kids' lives.
Well, how do they get those to the kids?
So they can contact Thomas Health Foundation. So, and then they can either deliver their donations to the Thomas Health Foundation.
Fantastic. Oh, that's at 424 Division Street, I believe.
Correct.
Yes. My old office, in
Yes.
fact.
Yes.
So, are there children that you can't accept or won't accept?
The kids who meet ICU criteria, just because we do not have pediatric ICU unit on campus.
Okay.
But hopefully, in the next few years with the expansion of our services, that's the hope.
You're already thinking about expanding.
Yes. So the growth is always a goal.
Okay.
So we are here to grow.
So that would mean if you had an ICU, you have to enlarge the unit.
Correct.
I'll tell you a couple of little stories. In the old days, when I first started, Thomas Hospital was the only hospital in this area that had a pediatric unit. And one Christmas, my son, Dr. Mitchell Rashid, the cardiologist, was in the hospital with an upper respiratory infection. We were able to get him out of the hospital like 2 days before Christmas. So my wife and I went up to pick him up, and there were these other kids. So I asked the nurse, are they all going to be discharged before Christmas? She says, no, there'll be several here. So the next night, Christmas Eve and Christmas, and every Christmas after that the unit was open, I would take toys for every child in the unit.
Wonderful.
They're great
And again,
people.
yeah. It's just again like we cannot do it. We cannot do it without the help of parents. We cannot.
Yes. And in fact, my staff and I would deliver 500 pounds of chocolates to the hospital. It was 100 boxes of 5 pounds of chocolates, and it would go to every nurse's station, every desk, every place in the hospital. We did that for years. Oh, it was fun.
That's amazing.
And some of the staff would dress up like elves, and I'd go over. So that was good. That made you feel real good.
Yeah, and actually one of the exciting moments as I'm seeing some of these pictures now, like we celebrated like first birthday of a like cute girl on our unit. Like first birthday is always special.
Well,
and we tried our best to make it special like birthday party for her when she was like sick.
Well, many people spend their first day in the hospital when they're born.
Yeah.
Out of the 5 of us, only one was born in the hospital. The rest of us were born at home, which was quite common around here in Detroit, where my family used to live. So you're looking to expand. You're thinking about an intensive care unit. So you might need help. What about residents? Is there a residency in this field?
So we don't have a residency program, but again, this is like one of the goals like we will hope to achieve in the next several years, to be able to have like learners on campus, including like medical students and like residents. So there is a big part of me about teaching. So in addition like to take care of patients, like, you know, I'm very passionate about teaching.
Well, do most of the big schools actually have pediatric units like this? Is this new, or is it out there and we just didn't know about it?
So like most like definitely academic hospitals, like they do have like a pediatric like, you know, units. Yeah, inpatient like, you know, units, it's out there for many years.
Do you see any real problems at the present time in expanding?
So we do have like, you know, it's just like with expansion, definitely we need to expand our team. So that will includes recruiting like more nurses, more providers, more specialists to allow us to be here on campus, to allow us to like, you know, success and be able to expand.
Well, I want to thank you so much, Dr. Masat, for taking time from a very busy schedule to come and tell our patients and our audience about what you do. This is a real new specialty, and I hope the public will give you all the support you need.
Okay.
And I'm certainly that Dr. Rosenkrantz and the staff will do so. And it's just wonderful that you're into this. This is not something we're used to in West Virginia. And so what we need to do is thank you, encourage you, and this is Dr. Richard C. Rashid, hoping you'll see a bright day.